everyone, my name is Candace Barnhart Johnson. I am your TA for the Craniosacral course, and this is my lovely friend River Rose, or Rose as everybody calls her here. Rosie is a North American Spotted Draft Horse. She is 25 years old. She has Cushing's, or PPID, and she has had a series of injuries. She had one injury that's resulted in a little bit of ring bone in her front right pastern, both the long and short pastern. She also has a fibroid in her right semitendinosus in her haunch, which does limit her stride, and so it has created a lot of discomfort and stiffness throughout her back. And she has always dealt with a weaker back and weaker abdominal muscles. So today what I'm going to show you is a demonstration of Rose with CST, and give you a little bit of a play-by-play of what it is that we're expecting, what I want to see in your case study videos, and also what you need to explain about what it is that you're doing. One thing that we've noticed a lot is that many students don't actually speak in their videos, which really doesn't help us understand that you know what you're talking about, or know what you're doing, and that you fully understand the point and the purpose of CST, or craniosacral therapy, and that you know how the therapy can benefit the horse and what it is that you're trying to accomplish. So what I'm going to show you right now is Rose's face, so that we can get an idea if there is any kind of asymmetry or dysfunction to her facial bones, her cranial bones. And so generally speaking, Rose is she's pretty symmetrical. She doesn't usually have any kind of disharmony or dysfunction to her cranial bones, but she does from time to time have weepy eyes. So I will probably do the lacrimal adjustment on her. And as far as specifically other cranial adjustments and going deeper adjustments on her head, chances are I probably won't, and the reason is because Rose is largely retired now. She's not ridden bitted generally anymore, and for the most part she is cared for and worked with in a very kind and humane way. So it's unlikely that she would need any kind of releases in her face. That's not to say that I wouldn't do them, just as a general maintenance and to complete a session with the intention of helping her relax throughout her whole body. Sort of just depends on her, and we'll go based on whatever she's showing me. Usually Rose experiences much more tension, physical and emotional, throughout her wither, her back, her sacrum, her hind end, those areas. So what we're going to do first is show you how Rose moves, to get an idea of what we're working with, where her, I'm sorry, there's flies. We're going to show you how Rose moves and how she carries herself, so that we can see, areas of disharmony, areas of dysfunction, areas of pain. I will also go through and palpate her, so I know where her biggest areas are and I know where to focus my session today. So without further ado, I'm going to ask her to go out and around and show me what she's got, and then we will get started.
So at the moment, I'm going to ask that Rose walk out, and she may or may not really stride out for me. But what I'm looking for is does she have any disharmony in the way that she is traveling? The way that she's standing. Is she standing square underneath of herself, or is she favoring? Obviously you can see that Rose has a dip in her back, and that is not kissing spine. It is entirely posture, and it's due to the fact that she, partly because of her age and partly because of her conformation, partly because of Cushing's or PPID, has a tendency to make her muscles and that entire apparatus through her back and through her core has a tendency to leave her weak. And it's something we work on a regular basis. So what I'm looking for is how she's moving, how she's carrying herself. She's kind of shuffling along, not really striding out. I'm also looking at how she's tracking up. Is it even? Is it not? Is she using her full range of motion, and, you know, or is she, again, is she stopping square when she stops? Is she placing her feet in such a way that she can take weight off of, you know, or unload certain areas? Essentially what I'm doing is I'm looking for dysfunction. I'm looking for any signs of lameness, any signs of tension, and she just wants to play right now. Come on, Ro. Come on, Ro. So yes, ideally, what I would love to do is have somebody to help me out doing this, because it's much easier to see if you have somebody walking the horse, as in like an evaluation that you would do for lameness with a veterinarian. But as you can see, Rose is short strided behind. She's stiff. She's on her forehand. And she's not really interested in striding out. Now, if I look at her hind end, she's also very tight in her hind end. Her range of motion is diminished. She's not very through. She's not fluid. And her abdominal muscles are not lifted, therefore her back is not lifted. Okay, these are all signs of a horse that's very stiff, very sore, carries a lot of tension in her hind end, and specifically in her sacrum and in her haunches. Okay, so the leg that she has the fibroid, or basically this massive ball of scar tissue, is the opposite hind leg. You cannot see it from here. But if you may be able to tell that her stride is actually shorter on the offside as compared to the near side. And you may also be able to tell that she is contacting or impacting the ground more abruptly with that foot than she is with her opposite foot. Okay? So now I'm going to ask that Rose trot. Come on, Ro. And we're going to do the same thing. I want to see, I would like for her to stride out. She doesn't really want to stride out, so that automatically tells me there's tension. I don't really see her lifting her back. She's lifting her head. She's hollowing out. Those are all signs of tension. And now she's bobbing her head. So she is very stiff, and you can also see behind. Keep going, babe. You can see behind that right hind is landing a little harder than the left hind. And she's generally pulling herself along as opposed to pushing herself along with her hind end. So all that tells me that there's a tremendous amount of tension through her back, through her sacrum. I also don't see that she's really using her haunches very effectively. She's very willingly going forward, which is fantastic. And Rose usually is very willing to go forward. But it's also really obvious that that stride is shorter than it should be. It's very tense, very tight. And good girl, Ro. Good girl, honey. But yeah, so that gives you a general idea. Now I'm also going to do walk straight away and trot straight away, walk straight up and trot straight up to the camera, so you can also see if there is any dysfunction or asymmetry that way. Okay, so we're going to do a walk up, trot up, so that you can see if there's any asymmetry, if there's any anomalies in her gait. I promise you there will be. Bonus points if you can pick them out. So again, I'm going to try to make sure that this is in the frame of the camera. And like I said, ideally, you would have somebody to help you do this, but right now I have my phone on a grapple on a gate, which works just fine. You can stick it on a wall, you can stick, on a bucket, whatever works for you, as long as I can see everything that you're doing. And like I said, your examination, your observation, palpation, they are just as important as the session itself, and they really should be done before you go into any kind of session, regardless of what the owner tells you, or regardless of that this is your own horse and you've known the horse for years. We still need to know, and I still need to know, that you fully understand how to conduct a session, you fully understand how to find dysfunction, and how to find disharmony in the horse, so that you know what to focus on most. And you also understand why these releases are able to benefit the horse in the first place. Okay, so without further ado, we're gonna go and see if Rose will walk off in a straight line, if she'll trot off in a straight line, and see what we get. Come on, Rose. Trot. Okay. All right. Now, since we've done all of that, I have what I need to go into my session, knowing what I need to focus on, knowing where the problem areas are for the horse that I'm working on. Now, I've known Rose for the better part of 15 years, and I would imagine a lot of you have horses that are very much the same situation. But regardless of how long you've known the horse and regardless of how much you know about the horse's problem areas, it's still important to do an examination, to do an observation, to do a palpation before every session. That way you know for sure what it is that you need to work on. And you can also articulate that to the client. So the first thing I'm going to do is I'm going to lay hands down her. I want to see if I can feel where her problem areas are. So I'm going to look at her face first. I'm going to feel from side to side, see if I can feel any asymmetry in her face. If she's got any bones that are more forward or more to the side. Generally, like I said, Rose does not have any dysymmetry, asymmetry, or dysfunction in her cranial bones, but that doesn't mean that she doesn't today, okay? Which is why we need to do our examination and observation to make sure that we don't miss something. Okay, so I'm going to apply just enough pressure that I can feel her bone, but not so much that it's uncomfortable. And I'm just going to run my hands along her face, looking for cranial sutures and trying to see if I can feel anything that's different. Now, what I do notice is that while there is I don't feel any difference in her cranial bones, but what I do feel is a difference in musculature right here on her frontal bone. So what I notice is that this side on the right is less developed than this side on the left, which would suggest to me that at the very least there might be some disharmony and asymmetry in her TMJ. So I could go ahead and do a TMJ release for her, and that may be beneficial. I could also do frontal bone. I could do parietal bone. So there's a variety of things that I can do to help balance that out. And as you can see, it's not really something that it's not so much something you can see immediately, but it's definitely something you can feel. So the other thing I want to look at is down here at her nasal bones and lacrimal bones. Come on, around, up here. By the way, this is also the first time I've done any kind of CST work on Rosie. So what you're seeing is 100% her reaction to not being handled in quite this way before. So what you'll find is that a lot of horses that are new to any kind of modality, they're going to be unsure, they're going to be confused. The best thing that you can do for them is to be patient and be cognizant of the fact that this is new to them. And if they don't necessarily want to participate, be respectful of the fact that they may not fully understand what it is that they're expected to do, and it may even be unsettling and scary to them. So certain behaviors that you might see with that would be just general fidgetiness. You could see nipping, you could see stomping, you could see weaving. She's going for flies at the moment. But you could see any number of different behaviors that would feel out of character, maybe to the owner. The other thing to keep in mind is do what you feel is safest for you. So I'm comfortable doing most things with Rose at Liberty. I have a halter on her only as a safety net, but that's not necessarily the case for other horses. If you feel you need to tie or cross tie, please do so. Use your judgment, do what you feel is appropriate and safe in the event with the horse that you're working on that day. Always be working with the horse that shows up that day. Don't assume that the horse is going to behave itself or that it's going to enjoy a session just because they usually do or they're usually cooperative. Every horse is an individual and every horse has bad days, especially if they're uncomfortable. So be mindful and be respectful of that. Now, same thing that I'm going to do with her face, I'm going to do with her neck. I want to palpate down it again, just enough pressure that I can feel the bone, but not so much that it's uncomfortable, especially if there was any pain involved. I'm also going to note if she shows me any pain response. So things that might be a pain response would be lifting her head, shaking her head, moving away. More expressive ways of showing pain would be nipping, stomping, pinning the ears, things like that. So, definitely, if your horse is showing you any kind of pain response, you want to make note of that, and make note that that may be an area that you need to pay special attention to. So, like I said, same thing, I'm going to go down her back, and I know that she has soreness in her back, but I want to confirm that through palpation. So, I'm going to look for, can I feel the tension? And I can. There's a lot of tension right here. There's a lot of tension right here. I can feel the differences. There's also quite a bit of a tension spot here, trigger point right there.
So if I was going to do a massage session with her, I would focus on this area right here. And like I said, I know that she has scar tissue back here, which is sometimes uncomfortable for her. And I know that she is generally more sensitive in her hind, but I'm going to confirm that through palpation. So, that being said, I'm going to go into a demo session for you. I'm going to explain what I'm doing and explain what I'm feeling throughout the whole session so that hopefully you can get a better idea of what you're doing.